Health Secretary Steve Barclay. A very good morning to you. You are announcing your NHS workforce plans today. Tell us about that. Just how ambitious is that plan?
Well, it's a hugely important day for the NHS. It's something that many within the NHS have been asking for a long time, to have a long-term workforce plan. It's the biggest ever expansion in workforce training in the NHS's history. It's backed up by £2.4 billion of additional funding over the next 5 years. And what it will do will train more staff, more doctors, more nurses, more midwives, but also give more opportunities for the staff within the NHS in terms of apprenticeships, developing more skills, their continual professional development, and also look at how we reform some of our training, making that more efficient so we can get care to patients quicker. We recognise from the pandemic there's big waiting lists, we've got a plan to clear those, but in terms of the longer term position of the NHS, we also need to boost our domestic training, and that's what the plan today sets out, that long-term vision for the NHS, backed up by £2.4 billion of funding. And the reason that's so important, it will give us the confidence the NHS will have the staff it needs to treat people in the future, boosting the number of doctors and nurses that we have.
And you say that people have been asking for this for a long time, and that's true, isn't it? The Tories have been in power for 13 years. Why has it taken so long to put this into place? And why did you have to wait until staffing vacancies got to such a record high?
Well, there's many things we've been doing to boost recruitment. There's 5,000 more doctors this year than last year. There's 50% more consultants now than in 2010. If you look at our manifesto commitments, for example, to have 50,000 more nurses, we're on track to deliver that, 44,000 now in place. If you take things like GPs, access to GPs is a big concern for many viewers. We had a commitment in the manifesto for 26,000 additional roles in primary care. We've already delivered on that. So we have already been recruiting more. And indeed, we set up 5 new medical schools back in 2018 because we had an expansion by a quarter, by 25% in the number of doctors we're training. So significant work has gone on, but we recognise from the pandemic, with an older population, looking to the long-term future of the NHS as we celebrate its 75th birthday, we need to put in place long-term plans in addition to the many things we're doing here and now.
Are your predecessors, your Tory predecessors who've been in power so long, are they guilty of short-termism then? You're the one who's bringing in the long-term view.
Well, for example, training a doctor is a long-term thing, and when the Chancellor was doing my job...
If you'd started 10 years ago, those doctors would be in place now, wouldn't they? And we wouldn't have record levels of staff shortages.
Well, there's a range of things that we have done, and what I'm pointing to is the fact that we had commitments in our manifesto to boost the number of nurses we recruited, to boost the number of additional clinical roles in primary care, and we have hit those targets and we're on track in terms of nurses to deliver it. In terms of earlier, there were things done to expand medical training, for example, the 5 new medical schools that went in. But what we also need to do is have a long-term plan in terms of workforce. This is the biggest ever expansion, backed by £2.4 billion, and this will give people watching the confidence that we will have the doctors, the nurses trained domestically, the NHS will need for the long-term position, and that's something many with the NHS have been calling for many years.
Well, yes, and many are welcoming this long-term plan, but what does that mean for the short term? We've got waiting lists at record highs. What's going to happen to those? This plan won't tackle those people who are waiting for operations and treatment now.
Well, you're absolutely right. There's much that we're doing now to deal with the consequence of the pandemic, and that's why we've got the 3 recovery plans in terms of electives. That plan is working. We've got a plan for urgent emergency care and a plan for GPs and primary care, dealing with the 8 a.m. telephone rush on a Monday morning that many people will be familiar with. So we're investing in those recovery plans. The plans are working. If I take electives, you can see the stark contrast between the performance in England, where we've cleared our long waits, the 2-year waits virtually eliminated in the summer, the 18-month waits over 90% cleared last March.
But the overall picture is poor, isn't it?
Well, by contrast, if you look at the position in Labour-run Wales, where there's much more people waiting 2 years, 18 months, we've dealt with that and we're boosting our capacity.
But just to say, 7.4 million people in England are waiting for treatment as of the end of April. That's a record high. Is Rishi Sunak going to be able to meet his pledge to bring waiting lists down?
Well, the plan is working. We're clearing our long waits, but also we're boosting our capacity. So let me give you an example. One of the things we're investing in is more diagnostic capacity. We've got 108 community diagnostic centres that are now already open. They're delivering 4 million tests and scans, which is key to identifying things like cancer early. We're launching community initiatives. Just on Monday, I was talking to a smoker who had his lung cancer detected much sooner. In the past, in our deprived communities where there's a higher number of people that have smoked or are still smoking, in the past, 4 in 5 of those had their lung cancer detected late. We've turned that on its head with a pilot that we've had there, with people being tested in trucks, in supermarket car parks, and 3 in 4 now are being detected early. And why that matters is it makes a huge difference to people's survival rates. If we can detect conditions early, treat them early, that makes a huge impact in terms of their survival. That's what we're investing in. That is working, and we can see that, for example, on lung cancer,
let's go
where
back
the survival rates
to
are
the
improving
plan,
significantly.
if we can. We've talked a lot about the doubling of places at medical school, as well as helping students become doctors quicker. So that's all about getting more people into the health service. But what about retaining them? You've got a problem hanging on to staff who are leaving in their droves, haven't you? What are you doing about that?
Well, again, I think there's 2 things. There's one in the short term. We're responding to requests from the profession. For example, one of the things that many doctors called for were changes in the pension tax arrangements. We've acted on that. But we're also looking for the long term to how people grow their careers within the NHS. How do we have new roles like physician associates that have already been introduced, but we can expand, give people more opportunity, and in particular around apprenticeships. There's huge opportunities within the NHS to offer more apprenticeships, and that's what this plan sets out, so more people can have a career ladder throughout their time in the NHS and take on more opportunities as their skills progress. So it's about having a better mix of skills, ensuring that people are able to operate at the top of their ability, and to give people that career opportunity to progress their careers, to take on an apprenticeship. That matters hugely to staff already in the NHS.
What also matters hugely to staff is pay, and currently we've got junior doctors and consultants are due to strike next month. So you need to tackle that, don't you? You need to resolve that issue, and don't you need to be more generous in future if staff are going to stay working in the NHS?
Well, we are tackling that issue. It's a very fair point.
You've got 2 huge groups of doctors in the health service, key people threatening to strike.
Well, we hugely value the work of our doctors, as we do all our NHS staff, and you can see that through the deal that we've reached with the NHS Staff Council. We negotiated a deal that was recommended by the NHS Staff to the 1.3 million staff on the agenda for change. That was agreed. That will go into pay packets this month. So we are making progress. In terms of doctors, there's got to be movement on both sides, and the demand from the junior doctors for a pay rise of 35%, I think for many of your viewers will recognise that is not something that is fair and reasonable. So there's got to be movement on both sides. We've shown that can be done through our negotiations with the paramedics, the nurses, the porters, the cleaners, the 1.3 million, the biggest staff group within the NHS, where a deal has been reached by the government. We're moving forward there. We now need to see a similar approach from the doctors. A 35% demand, I don't think, is reasonable given the context of inflation, but we absolutely value the work they're doing. And today's announcement, £2.4 billion into boosting the numbers of staff in the NHS, responding to something the NHS themselves have called for many years, will give people the confidence that we're training the doctors for the future. We're boosting the nurses, the midwives, but we're also giving wider career opportunities for many staff in the NHS who want to be able to progress their careers.
OK, Steve Barclay, these details coming out at 9 this morning, that's right, isn't it?
9 or 9:30, yes.
OK, you've got a busy morning ahead of you. Thanks very much indeed for coming in. Thank you.